Hello, everyone. Thank you so much for joining me today. My name is Shayna, and I will be speaking to you today about my experiences as an HIV tester in the United States. I'll begin with just a bit of background about myself. Then I will go into the major themes that I've seen as an HIV tester and counselor. And then I will end with my current research on HIV prevention, as well as some future goals that I have in regard to this topic. So to begin, I first started doing HIV testing during the first year of my MSW program in South Florida, specifically in the Fort Lauderdale area. And during my time as an intern, I did HIV testing as well as HIV education groups at different local facilities. Specifically in those groups, I would discuss HIV transmission, HIV prevention, HIV treatment, and then I would answer questions that the clients had. During the times that I would do the HIV education groups, I began to notice a lot of misconceptions from the individuals I talked with about HIV transmission. Most times individuals knew what HIV was, but they weren't aware sometimes of how HIV was transmitted, specifically which bodily fluids HIV is highly transmitted through, which bodily fluids that HIV was not transmitted through. For example, individuals would often ask if it's possible to get HIV from using the same toilet as an individual who is living with HIV, or maybe hugging or kind of casual contact with a person living with HIV, and other things of that nature. And in the time that I would also do HIV testing, I would notice individuals were not really aware or had misconceptions about HIV prevention. Most individuals oftentimes would be aware of condoms as a viable HIV prevention option. They would know where to get them. Oftentimes the facilities that I tested at would have them available for free. But when it came to other HIV prevention options, individuals were not often aware of biomedical strategies such as PrEP and PEP. PrEP, for those who you don't know, stands for pre-exposure prophylaxis. This is a way of taking HIV medications to keep an HIV negative individual HIV negative. This type of medication is usually taken over time and is similar to a birth control pill. And then there's also PEP, which stands for post-exposure prophylaxis, which is more similar to a Plan B. It's an HIV prevention medication that is taken after an individual is exposed to HIV to help them remain HIV negative. And oftentimes individuals were not aware at all of either of these medications when I was testing. And if they had heard of the medication before, they usually were not really aware of how it was taken or when they should take it or where to access it. They had just heard the name. So all in all, in those experiences through the groups and the testing, I came to notice that a lot of individuals were not very aware of how to prevent themselves from contracting HIV if they were HIV negative. And I really think this is a very important topic to discuss and keep in mind. And one thing I've always thought a lot about, especially in my PhD program in researching HIV prevention, is the lack of consistent sexual health education that occurs in the United States. There's varying degrees of sexual health education that's provided to students. Some individuals get great information, great programming, and they learn a lot. Other individuals sometimes don't get any or get information that might be misconstrued or they might be misinformed. So I think that's very important to address in regard to adults who I've tested not knowing a lot of information about this really important topic. And other times as well, I believe that information gained possibly from the internet or other peers might not be accurate, and misconceptions and misinformation about HIV transmission and prevention might go and travel throughout the country and travel throughout people, and individuals are not able to access potentially accurate HIV information. So with that, I'm currently in a PhD program, and my dissertation topic is actually looking at post-exposure prophylaxis, which I mentioned before, and how LGBT plus students, college students, feel about the medication and if that's a viable HIV prevention option for these individuals, in an effort to really examine HIV prevention and to see not only knowledge, but also what is going to be a viable option. Because if an individual, isn't willing to take a certain medication or action, or doesn't feel comfortable doing so, or doesn't know about it, it might really, be not a viable option for them. So in moving forward after I graduate, I would really like to further study HIV prevention and looking at, maybe furthering my topic of examining PEP in other populations, as well as possibly PrEP, which I do know is a little bit more well-studied currently. So all in all, I think it's really important just to highlight that there are discrepancies in knowledge among the adult population within the United States, at least in the individuals that I've tested in Florida. And to highlight that, I really think it's important to be aware of these discrepancies in order to find solutions for this lack of information or maybe misinformation through sexual health education programming and other types of education and outreach that HIV testers could do. So thank you so much for watching this video today. I'm open to any questions, comments, or feedback that you all have, and I appreciate your time. Thank you so much and have a great day. Goodbye.